Hey, this is Dr. Barry. In this video, I want to talk to you about something that's very important. If you're taking a calcium supplement, stop it right now. It does not make your bones any stronger, and it could absolutely increase your risk of very bad medical outcomes. Okay? First, please take 1 second and hit the subscribe button right there somewhere. That helps me spread this message to people who need it and to spread future messages. So click the subscribe button and maybe hit that bell. Now let's talk about calcium. This is one of those subjects that we all think we know exactly the truth about this matter. It's not open for debate. You should take a calcium supplement. You should drink lots of milk because it makes your bones stronger, right? Okay, if you're nodding going, yeah, that's right, then you need to watch this video. This is very, very important. I've been studying this issue for a while. I've been looking into research, and what I'm about to tell you, you're probably not going to believe. What you've been told strengthens your bones actually doesn't at all, and it increases your risk of having bad medical outcomes in other parts of your life. At the end of this video, I'm going to tell you the three things that absolutely have been proven by large research studies to increase your bone strength and decrease your risk of a fracture. You may not believe how simple it is and how cheap it is. Okay, so let's talk about calcium. If you're my age group, you remember all of a sudden we were being told in the media, oh, you need to take a calcium supplement. It helps keep your bones stronger. It's very good for you. You don't get enough calcium in your diet. You need to take calcium. And so we all thought, well, calcium, bones have a lot of calcium. Yeah, it makes sense. Okay, so we all started doing that. Problem is, this is one of those evidence-based medicine things that wasn't based on any real evidence. It was based on expert opinion. And so I think I've talked about before the hierarchy of medical research. The best medical research of all is the placebo-controlled double-blind study, because you get real answers from that if you're able to do a big enough study. And then as you come down to observational and other kinds of studies. At the very bottom of the barrel, if you don't have anything else to go on, then you get a bunch of experts in a room and you ask their opinion. And then that's what you base the recommendation on. Taking a calcium supplement was based on none of this at all. It was based on expert opinion. Yeah, that's right. That's exactly why you've been taking that calcium supplement for the last 20 years, is because they got a bunch of experts from Harvard and other places in the room, and they decided that was in your best interest based on no meaningful research at all. Not joking. So, wait a minute, Dr. Barry. You're telling me that there's no big research study that shows that taking more calcium increases your bone strength? No, there's not. There's no study that shows that if you take a calcium supplement every day, you're less likely to have a broken bone. No, there's no study. That study does not exist. Yeah, true story. So what the heck's going on here? So they actually, they wanted really badly to prove this. So they did some big studies. But at the end of every study, when you looked at the true meaningful results, background noise. It didn't do anything to increase your bone strength whatsoever. Not a single study has ever proved it. Now, let's talk about a couple of thought exercises here, and I think you'll get the reasoning behind what I'm saying. There are about 5,700 species of mammal on this planet. Now, the definition of a mammal is that they make milk for their babies. That's what a mammal is. They have mammary glands. And there's about 5,700 species of mammal on this planet. But only one of those species drinks milk as an adult. Do you know which one it is? Humans. That's right. We're the only ones, unless humans force our cats and dogs to drink milk. No other adult animal on the planet, no other adult mammal does that, period. Not a single one. Now, out of the 5,700 species of mammal on this planet, do you know how many species gets osteoporosis or brittle bones? One. Humans. That's right. Yeah. So just immediately your common sense should kick in and you should go, what? Wait a minute. Okay, here's another thought exercise. There are 195 countries on this planet, or 193, depending on your political and religious orientation, but about 195 countries on this planet. The countries with the highest milk intake, the countries with the highest calcium intake, are also the countries that have the highest fracture rate, highest hip fracture rate, the highest rate of osteoporosis. So the countries that have the lowest calcium intake have much less osteoporosis, much less brittle bones, much less in the way of hip fractures. I mean, so you see my point here? First of all, the common sense is totally against this if you look at it like that, right? So with those two thought exercises, your common sense muscle ought to be kicking in big time, saying, wait a minute. So when the researchers who fervently believed that more calcium would make your bones stronger, they did design these huge studies to prove it. Problem is it didn't prove it. It actually proved that calcium had no effect on the bone strength at all. So what did those studies? They found some things, but it wasn't stronger bones. What they found was is that taking a calcium supplement certainly increased your risk of a heart attack. Yeah, yeah, a heart attack. Your rate of heart attack, your risk of heart attack goes up as your calcium intake goes up. Whether it's from milk, whether it's from a calcium supplement, calcium intake makes your heart attack risk go up. That obviously is not a good thing. They also found that quite likely the more calcium you take, the higher your risk of kidney stones. And I've never had one, but when a woman tells you that something hurts worse than childbirth, you don't want that. And I've had many a female patient tell me that her kidney stone was worse than having a baby. So calcium supplements almost certainly increase your risk of kidney stones. Promise you don't want that. Almost certainly taking a calcium supplement increases a man's chance of having prostate cancer. Another finding was that it almost certainly increases a woman's risk of ovarian cancer. Just taking Citracal or Caltrate or any of the generic calcium supplements, or just drinking lots of milk thinking that the calcium is going to do your body good or do your bones good, all it does is increase your risk of heart attack and probably increase your risk of cancer and kidney stone. So there's no benefit whatsoever to taking a calcium supplement. You got that? Now, here are the three things that you can do that are almost free that will definitely increase your bone strength. Now, there are some prescription drugs that your doctor can prescribe for you, like Boniva, Fosamax, Actonel, Forteo, that increase your bone density. Now, density sounds like strength, but the problem is when they do the big studies, even though these medicines they do increase your bone density, they evidently don't really increase your bone strength because they barely affect fracture risk at all. So if you're taking any kind of calcium supplement that's over the counter, go get it right now and throw it in the garbage. You'll actually be saving money, not wasting money. If you're taking a prescription medication to prevent or to treat osteoporosis, I want you to go back and see your doctor and say, hey, doc, this crazy doctor on YouTube said that this medicine makes my bone density stronger, but that may not be the same thing as bone strength. Is that true? See what he says. Watch his face. Watch his expression. We'll just see what he says about that. So the three things you can do to increase your bone density that have been proven in those big studies, that have been proven time and time again to make your bones stronger, because that's what we want. When you fall, we all fall. When you fall, we don't want you to break a bone. We want your bones to be strong enough that they don't break. That's what matters. I don't really care about your bone density. I don't really care about anything except when you fall down, I don't want you to break a bone. I also don't want to cause you to have a heart attack or cause you to have a kidney stone or cause you to have cancer. Okay. So the number one thing you can do that's absolutely free that will increase your bone density more than anything else you can possibly do is weight bearing exercise. Now, I've told you before, exercise won't help you lose weight, but it will make your bones stronger. I don't mean walking on the treadmill. I don't mean on the Stairmaster. I mean weight bearing. So either walking briskly, running, lifting weights. Those things stress your bones, and that makes your bones stronger. We all often think of our bones as rocks. They're just rocks. That's it. They're done. They don't change. When you're an adult, your bone is what your bone is, and you can't do anything about it. That is absolutely false. Okay? Your bones are like trees. They're constantly growing. They're constantly getting stronger or weaker. They're getting straighter or they're getting more bent every day based on what you do and what you eat and what you take. True story. No argument there. So your bones are going to get better or worse based on, are you doing weight bearing exercise? So if you go for a walk every day, if you lift some weights, your bones are getting stronger. If you go to work and sit for 8 hours and then come home and sit for 8 hours and then go to bed for 8 hours, your bones are getting weaker. Definitely. No doubt about that. So find some time once or twice in your day to do a few minutes of a weight-bearing exercise. It's free and it's proven beyond any doubt to increase your bone strength. Okay. Number two, take a vitamin D supplement. Don't take a calcium supplement. Throw the calcium in the garbage, but take a vitamin D supplement because that will make your bones stronger. Okay. Number three, stop drinking milk. Remember, this is coming from a milk baby. I grew up, I was a football player in high school in my teenage years. I drank almost a gallon of milk a day. My family propagandized milk to me to the point where I almost had a religious fervor belief in milk. Only with years of thought and study and looking into the research have I come to my current opinion that you don't need milk at all when you're a grown up. So don't think that I've drank the Kool-Aid. I've put the Kool-Aid down. You don't need to drink milk. All milk does is increase your risk of cancer, heart attack, kidney stones. You don't need it. Stop drinking it, okay? If you love milk, have a small glass once a day as a treat, but don't consider it food because it's not, okay? Now, last thing I need you to do for me, I really need you to help me share this message, and I'll tell you why. I found out that my 88-year-old grandmother, just the other day, I found out she was still taking a calcium supplement. Knowing what I know, I see my grandmother all the time. We talk at least twice a week on the phone. It never occurred to me that she was still taking a calcium supplement. Your grandmother's probably taking one too. Your mom, your aunt, your sister, they're taking calcium supplements because they got into the habit. Women are really good at getting into habits of things that they think help themselves or others. She's got that, and she's put it in her little pill box, and she takes it every day, and she doesn't think a thing about it. Please share this video with your mom, with your sister, with your grandmother, if she's on social media. If she's not, she will be shortly. You've got to share this because I guarantee you've got loved ones who are taking a calcium supplement and increasing their risk of heart attack right now. Please help me get this message out and prevent heart attacks. Please help me get this message out and prevent prostate cancer, kidney stones. Please, let's prevent kidney stones. Let's keep these things from happening, and let's spread the word about what actually makes your bones stronger, okay? Now, if you'd like to help me have more time in my day to make these videos, I have a Patreon account, and you can give me $1 a month. That's all. I mean, literally, that would help so much because I have to take time away from my duties in the clinic or away from my family to make these videos. I love making these videos, but there are only so many hours in the day. So check out my Patreon page if you want to help. This is Dr. Barry. I'll see you next time.